Okay, so these practitioner calls are really fun because it gives us a chance to hear from professionals in their setting and how they use the patches. Sometimes it's their personal story, sometimes it's how they're using them, sometimes it's just them sharing their expertise and teaching us something. So they're always different, but they're always really incredible. So right now, we don't go over what each of the products are or anything that we're just letting these guys share from their perspective. And Terry is my good friend and always my co-host, my Canadian co-host. He is the OG. He's been here from the very beginning of Super Patch, and I'm going to turn it over to you now, Terry.
Wow, thank you, Ricky. Yeah, we're so excited to have everybody on this call, and it's always a real pleasure to work with Ricky James and Carolyn Dow, and the Cool Prophet has been in this group as well, contributing, and to all the practitioners that are here. We really appreciate you taking the time to spend a little bit of time and share some stories, educate us a little bit, and explain why you decided to link arms with this phenomenal technology in this company. So, Dr. Anna Toker. Well, Dr. Anna Toker is an award-winning and renowned board-certified colorectal surgeon in the Dallas area. And she has a unique ability to translate complex concepts into everyday language. Patients from all over the country seek both her surgical skills and her nutritional advice. Not only is she a phenomenal surgeon, she is a phenomenal person. And I think the Super Patch company is very, very fortunate to have Dr. Anna as one of its board members, one of its medical advisory board members, and she is a wonderful person. If you ever get a chance, follow Dr. Anna on Instagram, follow her, join her YouTube channel. Man, she's got some incredible, incredible things, and these patches have made a difference in the quality of her life and the quality of people that she looks after, patients, friends, whatever. And it's an honor and a great pleasure to have Dr. Anna here. Dr. Anna?
Oh, Terry, you're so sweet. Well, welcome everybody. Thank you for inviting me, actually. And I guess I'll just kind of tell you a brief story of me and then what my role would be um with the Super Patch Company to kind of help guide the crowd in how they explain the technology to people, and what you should and should not sort of make a claim about. And because all of you know that the technology works quite well. I met Jay completely by accident on an online TV show on Brinks TV or Brinks.tv, a fitness show with Mark McDonald, who's a nutritionist and who ran our planks thing. And Jay was being interviewed and was going to be a sponsor of the show, and I was a recurring person talking on it. And as he is being interviewed, and I had not yet, I didn't know who he was, I'd never heard of Super Patch or whatever. He starts describing this technology. And while he's talking, I got my phone out and I wound up ordering like $300 worth of these patches just on the interview. Because what the guy was saying, if you've ever had a conversation with Jay, you'll know this to be true. Um, he's a brilliant engineer. And so the way he was describing the technology completely meshes up with something that should absolutely work 100%. So I bought a bunch of these patches. Then I got to meet with him. He and I have had several multiple hour conversations discussing his life and technology and whatnot. When I got my patches, the first one I used was the pain one, because I was debilitated from psoriatic arthritis and was looking at maybe losing my practice because I couldn't move. And it was shocking how well that worked, which means if it's working on me, maybe it'll help my daughter's anxiety and maybe it will help this. And ultimately, what I wound up doing is designing a protocol for my patients and enhance. In surgery, we do something called the enhanced recovery after surgery. It's basically a preoperative, intraoperative, postoperative series of events that we do to improve a person's travel through the trauma of surgery and healing after surgery. And if you do certain things at certain times, you can vastly improve a person's outcome. So we call that enhanced recovery. Fine. I have an enhanced recovery that just was nutritional, really more than anything, physical activity and nutrition. And then I designed some little additions of these patches. This has made an enormous benefit to my patients because I don't use narcotics after surgery anymore. These patients don't struggle with mobility afterwards. And as a brief interlude, in case any of y'all are interested, if you're about to have surgery, the patches that we use for that are going to be obviously the Freedom Patch for pain, Liberty Patch. So the patients after surgery have a lack of balance and are at risk of falling and hurting themselves. In fact, 10,000 people per year in America alone will fall and hit their heads in a hospital setting and die as a result of that. Actually, about 1 million people fall, and about 10,000 will die as a result of a head injury from falling. That seems crazy. So, not on my watch. So, we do Liberty Patch for that. You cannot heal unless you're in a restful state. And so, a peace patch is important for that stress response. It also keeps you from having to give anxiety medicines. And of course, sleep, you heal while sleeping. So, a REM patch. So, those 4 patches, and on occasion, I'll add a Defend patch. And maybe even a Lumi patch, because Lumi increases the collagen in your body. Your body needs controlled inflammation, a lack of stress, collagen deposition, proper nutrition, obviously, and a control of the blood clotting pathway. And so I use basically those 5 patches in the post-operative period. And then when I presented that to Jay, he was like, "Well, that is amazing. And I can't believe I understood that. And would you sit on the medical board?" And I thought, "Sure, fine, that'd be fun." So I've given a couple of talks to the crowd, and y'all have always welcomed me so nicely. My role as the medical director is no longer to sell to the crowd how well they work. That's what you guys will do. My job is to explain exactly how it is this technology works and what you shouldn't use as the claim to the technology. So the steps of how this works, because it is not placebo and it is not magic, and we know it works based on a couple of things. The first is on Jay's original, when he designs these patches, he does so using a 3-dimensional EEG. And I'm sure y'all have all seen that in action, where you can see the parts of the brain that are not quite in balance, like they're out of whack. So balance would be homeostasis. And so that would be the green part on that 3-dimensional map. And then anything that's out of balance, working too fast, working too slow, will show up as either yellow or orange or red or something like that. So that pictographic EEG makes life real super easy for the simpletons like me who do not know how to read an EEG. That is proprietary information, which he'll never share with anyone, how he programmed a computer to interpret those EEGs in that way. But this is how the first way that you know that it works, because you can see a part of the brain turn green based on something on the skin. The second issue is that we do these placebo-controlled trials. In fact, we're getting ready to start one in my clinic on balance in particular, with the hopes that 10,000 people per year do not need to die from falling in a hospital setting. And I think something like Super Patch, there's nothing proactive that you can do to keep a person from falling. There's like no known medicine you can give someone other than strapping them to their beds. And even that doesn't help, because people have to get up to use the restroom, or they wiggle out of that in the middle of the night. They get confused. And so this is the perfect opportunity for our technology, and that study is IRB approved. We're recruiting patients, and we'll have hopefully an answer by our next meeting in January, I guess, when we meet again. The steps of how this works is based on physiology and Nobel Prize winning science. So Jay did not invent any of the science. He didn't pull it out of his cheeky buns there and just make it up. He's basically reviewing the literature on neurology. He's taking known and Nobel Prize winning science, And like all brilliant engineers, is figuring out how to use somebody else's science to benefit humanity. And I believe he's done that. Basically, the way the human body works is this. Everything in your body is controlled by your brain. Everything. Um, just us standing upright, us being able to breathe, our heart beating, your blood sugar control, your blood pressure, temperature control, blood clotting, your immunity. Like there's no aspect of your brain, whether it's hormone production, the wakeful state, the sleeping state, anxiety, your emotions, all of these things are controlled by the central aspect of your brain. It's a primordial part of your brain that heads up what we call the autonomic nervous system. And the first lecture I gave for Jay was one that kind of explained the autonomic nervous system falls into two categories. There's one that is kind of the fight or flight, right? So you're under stress, and this is your body's ability to combat, run away, fight. It's the stress response. And whether you are in traffic or you got a tax bill from the IRS like we just did, or you're an athlete, in combat sports. This is a diehard stress. And so some aspects of the stress response you need. The problem is in the stressed state, your body can't actually heal. That's supposed to be a very short-lived spurt of time in the modern life. It's all the time. It's one of the reasons our brains don't light up green when we do the EEG. That stress response throws things out of whack, and your brain is responsible to try to reel it in. The second your brain can no longer reel in a pathway, you get a symptom. So these patches are not going to cure a disease, but they are going to reel back symptoms. So that's the first bit of advice I would tell you. Never say, oh, you have Crohn's disease. Well, this is what you should use. Don't ever say that, because then people will assume you're saying that it fixes Crohn's disease, and it does not. But what you can say is, well, your belly cramping um, is part of a stress response, and you might find that that feels better if you use a peace patch and a liberty patch, because those things will help vagal tone and your stress. Does that make sense? So symptoms are what we're treating. So that's the first bit of how the brain works. The second pathway is this parasympathetic pathway. Everything in your body heals and functions normally when you're in the resting state, the parasympathetic state. So if you're stressed all the time, how do you get your body into a parasympathetic state? That's the real problem. And right now, the only known ways of getting your body into the parasympathetic state would be drugs that don't really, there's so many side effects to drugs that force you into that parasympathetic state that they're dangerous. You can meditate. It can take years to learn how to meditate in this way. They do have, and a lot of people, y'all have a watch, a little biometric watch where you can control your breathing, you can control your pulse. That's called biofeedback. There's some devices out now that are called neurofeedback, where like you wear it on your head. It's like a mini EEG, and you can kind of, it makes you like blow up and down a little balloon size with your brain. Essentially, what it's doing is trying to teach you how to ramp up the parasympathetic and calm down the sympathetic. Now, that's awesome until you stop the deep breathing and until you stop doing your meditation, or until you wake up at night. All of that goes away. So there really is no known way until Jay Dallowall to put a pathway into that restful state without you having to do anything. So it's a biofeedback physical therapy device that does not require you to learn or interact with at all, as long as it's making contact with a piece of skin that has good sensation. And as long as you don't have a deficit, like you had a stroke, or maybe you have a severed nerve in your back or something like that, then this signal will get to your brain. Okay, so this patch works as a biofeedback physical therapy device. and you do not have to interact with it, unlike any other biofeedback device that is on the market. And the way it's going to work is this. It's going to go onto your skin. Each and every one of those devices has a particular pattern on it, and that particular pattern will determine how far into the brainstem the signal is going to travel. And I'll explain kind of why that's important in a minute. But okay, the patch hits the skin. The signal is very, very fine. If it were any more prominent, the rest of your brain would recognize that it is there. It would be annoying. It has to be a very fine signal so that you're not consciously aware that it is present. Okay. And that fine signal is going to wear out over the day, which is why the patch only lasts about a day. And the second you get anything between your skin and that patch, that signal is going to disappear. So it's important that it sits well, and it's important that it doesn't crinkle off, and you don't cut it, and you can't put, like, make it last for multiple days. You can't peel it off and put it back on, because you'll destroy that little signal. Okay. When it touches your skin, anatomically, what is happening is in your skin, there are receptors that will take vibrational energy, right? To the vibration thing the other doctor talked about. Vibrational energy, and it translates it to electrical energy. This is important. You are getting vibrational signals from your entire environment. The earth right now is sending a signal to you, even though I know you can't perceive it. But if you were in outer space and away from it, you would get sick because of its absence. You have to have these vibrational signals are critical. Okay, well, your body also uses that to communicate with its environment so you don't fall on your face, or so when a spider touches your skin, you can screech and then run away and get it off your skin. These signals will go from your skin, convert to an electric signal, which is going to go up a sensory nerve. And that's all sensory nerves of your body are going to make it to your spinal cord. The back part of your spinal cord is called the dorsal column, and it is responsible for your balance. Your proprioceptive balance starts in that posterior column. Okay. Then it goes up your brain, and then it hits something called the medial lemniscus, which is kind of at the base of your skull. And that's where the right side and the left side kind of cross over. This is why your left brain controls the right side of your body, and vice versa. And then from there, it goes forward into a part of the brain called the thalamus. And in front of the thalamus is the hypothalamus. In front of that is a prefrontal cortex. And then behind all of that complex is the cerebellum. And slightly lateral to all of that is going to be basically an organ called the amygdala, which is part of the hypothalamus. Why is that important? Well, if you want balance, then you're going to want a signal that stays kind of in that posterior column and then goes backwards to the cerebellum, because this is your body's balance center. If you want to sleep, however, you want that signal going a little bit more forward to the hypothalamus. If you want to focus, it really has to go forward to the prefrontal cortex. And if you want to get rid of anxiety, it's got to go kind of in the middle and out just a smidge to turn off the amygdala, which is the thing in your brain that ruminates over bad things. This is where a lot of us get our stress from. And so each one of these patches has a signal that penetrates ever so differently through the brain. You can see that on the EEG. I know he's never outlined that when he's talked to y'all, but I can see it when I see even these very old EEG videos that you guys have. I mean, I'm like, well, hell, no wonder it helps your balance. I mean, the cerebellum lights up green in that video, right? Oh, well, no wonder this wakes you up, because it's like that. It like goes all the way to the front and a smidge out to the side. So the EEG is the one thing that he would guard with his life, and he'll never tell anyone how he's programmed his computer, because that is proprietary software. Now, having said that, these devices, because they have no medicine in them, and because provided that sensory nerve makes it to the spinal cord and there's no severance between the spinal cord and your brain, it is going to work, which is why like 99% of us have a positive result as a result of using these patches, but they're going to reach a part of the brain to get to a symptom and not to a disease state. A disease state is a series of symptoms, so like a diabetic has a lack of balance, but then they also have blood clotting issues, high blood pressure. And so there's a number of different symptoms in the disease state that we call diabetes. So I would say, as someone who's on the medical board, that it's most important that you remind people, like, this is for a symptom. The second you take it off, it's gonna stop working. So it's not gonna cure anything. If you use something every single day for a long enough period of time, you very potentially, although we don't have evidence of this quite yet, but I've seen it happen in my own life because I don't need that freedom patch anymore. But you can get your brain to remind itself what normal is permanently. It's almost like a touchstone, like if you're walking down a dark hallway, you have to touch the wall to kind of give yourself balance. Like that way, what's up and down. That we consider that a touchstone. These patches are basically touchstones for certain parts of your brain to remind it, oh, yeah, that's what normal is supposed to be. Now, if you wear that patch every single day, yes, it stands to reason within, I don't know how length of time, everyone's probably different, that the touchstone has worked and your brain resets back to normal. You can't make that claim, even if it's worked that way for you, because we haven't done the study on that yet. Although I suspect at some point we'll get to it. These studies are all very timely and very costly. And I don't know if Jay has that particular study. I should ask him if he has that particular study in mind, but I do. I think it's of value. And I think as a physician, in my mind, these patches would be used before the symptom shows up because you can pick up on the problem with an EEG. But the problem is, how would Jay mass produce those EEG machines without someone hacking into the proprietary software? That's the only problem with that plan. But however, you can diagnose someone with an EEG before they experience a symptom, and that would be the time to use the patch before the symptom even shows up. Once you have symptoms, you're starting to have end organ damage, which cannot be reversed by medicine. It can't be reversed by these patches. End organ damage is a surgical problem or a you can't fix it problem. So our job as physicians is to get to it early. Don't let the brain get so out of whack you have a symptom, and certainly don't let it go on so long there's end organ damage. So I do see that as a very early in the quiver, so to speak, of a physician. Let's start with this, and this right now before there's a problem. So that's my thoughts, Terry. If you have any questions about what I
I
just
do.
told
I have
you.
a question because since you're on here talking about this, would you share with us the Peace Patch study, like kind of how that went? Because we've had, people are always talking about that we had the Peace Patch study and the REM one, kind of what those showed. Would you tell us? Because we hear about the Freedom one all the time. We've got that one down, but we have a lot
Yeah.
of questions on like the REM one and the Peace one. So since you got
Yeah.
into that piece so much, I'd love to hear you talk about it.
Yeah, and so it is interesting. We have some patches, some studies rather, that are online because those are what we would consider class A evidence, double-blinded, placebo-controlled, peer-reviewed studies. And the Peace Patch was done not, I don't think it was done as a placebo-controlled. So I don't think they published or they make that a public study. But the study that I've talked with Jay about that I've seen briefly was just a paper that talked about using the EEG as a guidance. Patients who meditate have a certain EEG finding. And when you wear a peace patch, you have that same EEG finding. So a peace patch is basically like knowing how to meditate without actually having to sit down and like meditate, because I do not have the patience or the focus factor to do that. So I always have to be moving. So for me, meditation is just not ever going to happen. That's just not going to happen. Whereas the peace patch will change my brain in the exact same pattern, if that makes sense. That is an observational study of a few people, and it's not a placebo-controlled trial. And I don't know if he's got one ongoing. I know I talked to the people at University of Arizona combining Peace Patch with the Liberty Patch in terms of microbiome improvements, because in my opinion, it's going to improve the microbiome. And so their microbiology department is working on that right now. But so and then as far as the REM study is concerned, that was placebo controlled, double blinded over a 2 week period of time. And that study should be on if it's not on the internet. I don't know why it's not on the internet, but it was placebo controlled. Probably their first one that they did. They took patients for a 2 week period of time, and they had one group not using REM patch, one group using it. At the end of that 2 weeks, the people who were using a placebo were offered the REM patch is what we call a crossover arm, and they were studied for another 2 weeks to see what the improvements are. And so now, and if it's not on the website, it might be, because following sleep is such a damn subjective thing. But these patients reported that using the REM patch at 2 weeks is when they intervened. So no one needs to come to you one day after using a REM patch. That doesn't work, because all the studies are 2 weeks. The study that I'm getting ready to do for balance is really only going to be 7 days. Why? Because we can show instant improvement in your balance by putting a patch on you. This is the balance study that they're talking about. There is a scientific way to study that balance other than just pushing people over, that gives you numbers that they actually use in Europe to determine your risk for falling in the hospital setting. So we're going to show before patch, after patch, using that Medtronic device. That way, it's not subjective. You can't say you're faking it. I mean, it's measured, and this is how hospitals in Europe actually study this problem. But in sleep, it is still a subjective thing. How long it takes for you to go to sleep. It was studied after a 2 week period of time. And it did show wearing a REM patch, you sleep longer, you sleep better, you go to bed sooner, or your eyeballs fall asleep sooner. So
Okay, no,
those,
that's awesome. And I'll look at that again, because I swear that our piece one that was released or in the end of 2024 was a clinical one, because or isn't that the one the World Congress of Psychology accepted? Um I'm fairly certain. And then it was featured in Mexico City at that convention.
maybe I
Maybe. I
put it
don't
out
know.
there.
Maybe.
I don't
I
know.
don't know. That's awesome though. Thank you so much. Like this is
Yes. What we got published, I know what and I reviewed that for Peter as part of the peer review process, but was a very important what we like to call in science, you would like to have peer-reviewed papers, and I'm writing one right now for the company. You want to have several peer review papers out there that review the literature, that give a rationale to use. Because physicians, when they look at studies, number one, won't even engage in the study. You can't get you can't get an IRB board to approve a study unless you've got a rationale for use. It's very difficult to do. And physicians like to see that rationale for use. That way we're not wasting everybody's time. So the study that was published right as we did the Orlando meeting, that was all the hullabaloo, was not a peace study. It was a rationale on the piezoelectric response and how this technology taps into the piezoelectric response. And because the piezoelectric response is a known pathway that improves EEG findings by way of biofeedback, these patches patch into that piezoelectric response, ipso facto, boom, boom, rationale of how this patch now helps your brain. Does that make sense? So that was the study we were talking about in Orlando anyway.
Yeah, no, that's amazing. There were, I think, a little group of them maybe released at
Maybe.
one time, but
I will
that is
I will
incredible.
have to look. I will have to look because I hadn't
Yeah.
seen that one got published, but I could be wrong. I could be totally wrong.
And you know what? I could be wrong too, but Terry, do you remember or do you know what? And someone in the comments is putting, yeah, I know it was featured at the World Congress of Psychiatry,
Yeah, I
and
know it's out there. I just hadn't seen it published, and I thought, well, maybe it's
yeah, you
not there,
want to be,
which is why I didn't want to make comment. But yeah,
You know, but the thing is for me,
yes,
it just basically in a very effective scientific way just shows how powerful our brain and our skin connect, and how these patches are basically that body-brain connector to get things back online again. And I've often said to people, as you said, that you got to give your body time. Um, because you didn't get the way you are overnight and you're not going to heal it overnight. But the body has an amazing capability of correcting things. And we've seen it, through neuroplasticity, we've seen it through a number of things, and just the body's ability to heal with a broken bone or a cut or whatever. And we just know that, by stimulating the brain with the right messages, that this is a process, not a pill.
yes.
And
Physical therapy, Terry. It's physical therapy.
mhm,
And this is
absolutely.
why this is an FDA registered device and it's not FDA approved. FDA is never going to approve a physical therapy device. It's not required. So it's a class one physical device is like a Band-Aid or an ACE wrap. It does not need, nor will it ever be done because the FDA does not grant approval on Band-Aids. You just register it and as it becomes sort of like a registered device. You cannot do human studies without registering the device. It's one of the main reasons it's registered. And this is how I know the competitors who have patches out in the market um, aren't doing human placebo-controlled IRB
Hmm.
guided studies because
Yeah.
they don't have FDA registered devices and that
Mhm.
you can't do an IRB control study. And for people out there, IRB just means study controlled by the World Health Organization and the Stockholm after, World War II put a list of things that you can and cannot do in human experimentation. The Canadian system and the American system will call this a review board process where people go over everything. And unless you can show that you've registered what you're talking about with the federal government, for safety purposes, you can't even proceed with the study. So
Hmm.
that's why it's a registered device. And so for anyone says, yeah, but it's not FDA approved. Well, yet neither is a Band-Aid, for goodness sakes. And it won't be. An FDA class one device means that anyone can use it with no education. It has zero risk to a human being other than maybe an allergy to the adhesive tape. It is the safest thing you can do to a human being is a class one FDA device. And that's what these are.
Hmm. Which is
Okay, so
actually,
so last question, because we can't open this up because now that we have you here, everybody would ask you a million questions. But I do think something that I get a lot of questions on is kind of like people asking, what's the difference between liberty and victory, something like that. The whole point of this, and you explained this so brilliantly earlier of showing they all connect to different neural pathways in the brain. Would you just explain that really briefly for us so that they all work synergistically really beautiful, right? But they're
yeah,
all different. They're hitting actually different areas.
correct. And I don't know what the pattern looks like. Of course, Jay's never going to tell us. And so I don't know what allows one pattern to go whoop, straight to the front of your brain like a focus patch. It's up here. Whereas one will linger back by the cerebellum. I don't know what allows that. It's something in the way the pattern looks. And of course, that's proprietary information. But when you read the little thing on the patch of the symptoms that it's improving, rest assured that's the part of the brain that this thing is going to ruminate in and really talk to. right? So the Liberty patch kind of sits more in the central aspect of the brain. It's going to, because it's going to help control vagal nerve response, and is why Jay considers it the IOC, the control alt delete of your brain or whatever, because it's hovering right there in that medullary area, the oldest part of your brain, and then it tickles a little bit of the cerebellum, but it really hits the dorsal column, which helps you with your balance, and the medulla of the brain, which helps control the vagus nerve and some of these more central aspects of your brain. Whereas an athlete, a dancer, a gymnast needs all kinds of cerebellar activity. You got to force that signal a little bit further back. By doing that force back, is it sucking away from what was in the central part of the brain? I don't know. But like even in my own mother, when we did the Liberty patch alone, kind of helps, meh. But if I slap both a Victory and a Liberty on her, now she's 87 years old, she's pretty athletic. When you put both of them on her, all of a sudden she's like, yes, now my balance is better. And it's just you needed more spread. Do you know what I'm saying? Like I like my focus to be a PC focus, right? So when I operate, I wear a focus and a piece patch. And if it's a super long surgery, I'll throw a boost on there, and then that's a boosty focusy PC patch. So, right. So I gotta, because you're kind of, you want that spread. And I wish he would come up with just like underwear that would hit all of it. That'd be,
Yeah, that's my husband says that. He's like, you'll need like a long one that you just roof off and
that's just a,
that's right.
and you can. But this is one of the reasons why you can wear as many different variety as you want to. They're not going to cross each other out in any way, shape, or form. They're just going to layer on because they just have different penetration patterns through the brain. That's been my observation based on everything that I've read, is the best way I can explain to the world, like kind of this is how it works. This is not magic,
Right.
and it is not disease control, but it is neurologic control in a little piecemeal fashion, which so sometimes you need more than one to kind of cover the pathways. If that, like
Yeah.
some people can't sleep at night, and a REM patch alone won't do it. Throw a piece patch on them also.
Or
Because
kicking,
the
right?
REM,
If they're having repetitive thoughts or something.
correct, because your stress is the amygdala over here, and your sleep is just slightly more central in the hypothalamus. So you kind of like understand anatomy, and maybe that should be my next talk for the super patch people. I don't know, but right.
Well,
So
the biggest thing you said tonight that I want people to hear is that there's no reason to bring disease names into this ever.
oh,
And I tell
ever.
people that all the time. I'm like, if you would, because here's the thing too, right? Like if someone had a stroke, one person has a stroke and could have these symptoms, another person has a stroke and have these symptoms. We're not treating stroke. We're not treating anything. We're symptoms is what you're working with. So you ask the
Right.
person always, I don't know about a stroke. You know what I do know about are these symptoms. And it's a very easy thing.
Correct.
You don't have to be a doctor, you don't have to be anything. It's just continually pushing
Well,
people back to symptoms all the
and
time.
I will also say, and it depends, like if you're in a state like Texas, physicians take this very seriously. The second you use a diagnosis and follow that by words that are designed to treat you, you are now practicing medicine. And so, unless you guys are medical doctors, you're not allowed to practice medicine. A nurse practitioner can, but like you have to have a license to practice medicine. Now, if you have someone with a symptom and then you suggest something, you're just a mom on the street. You know what I'm saying? Like that's over the counter stuff. So you want to be mom and dad on the street, your best friend, your buddy, your coach, your teacher. But you can't be someone's doctor. And even I, when I speak to people, unless they're my actual patients that I'm having one-on-one conversation with, let's say I'm giving a video online, I'm not saying, hey, all you people out there with IBS, this is your treatment. Because that sounds a hell of a lot like medical advice, which I do not want to be giving to people I've not established a physician-patient relationship with. So it is important for your own safety. Now, I carry a multi-million-dollar liability policy. So unless y'all want to start covering liability policies for yourselves, I highly suggest you don't practice medicine. And you'll get brought in front of a medical board, not just a court, but the medical board, which has the right in any state in America to put you in prison for illegally pretending to be a doctor. So I would highly suggest against it. Furthermore, poor Jay, right? He's got enough problems. Yeah, he doesn't need to be cleaning this stuff up. This is why we didn't have the flow patch for a year. Do y'all understand? And
Right.
I love that flow patch. Holy crap. In fact, I just bought, y'all told me there were packs. I just bought my pack of Flow Patch while I was in the wings there.
Yeah.
But a poor claim like, oh yeah, this is going to cure MS is what can like torpedo what truly might be one of the greatest medical inventions of our lifetime, as simple as it may seem to look at a piece of plastic. It doesn't even make any sense, but the way its simplicity is genius. I call it alien technologies. It's truly the way the human body was designed. And it just took a friggin' genius to put point A and point B together. That's all. And it is amazing. And so for Jay's sake, I would say please never use a diagnosis like a disease and instead use a symptom. Your back hurts. Hey, this helps with your back. So does an aspirin, and so does a Tylenol, and so does an ibuprofen, and so does this Ace Wrap, and so does that heating pad. This one, however, has no medicine, no side effects, and you just use it once a day. Like it's that simple, if that makes sense.
Yep. No, perfect. Thank you. I just wanted you to say that again. I really wanted everyone to hear that, all of that part again. It's super important.
Yes, and feel free to cut these little clips out and play them over and over again.
I think we'll do
Because
that. I think we're going to make
yes,
some of you telling people what to say and not to say so that it
yeah.
can be.
Mhm.
We're on it,
Yeah,
right,
I mean,
Terry?
there's a reason why we're recording this, Ricky.
Yes, for sure.
You
Yeah.
know,
Yeah.
very good reason why we want to use the knowledge and professionalism of Dr. Anna to do it right.
Yes.
We have a phenomenal technology and we all have a fiduciary duty here to understand how to present it properly.
Yes.
And I think Dr. Anna has made that very, very clear tonight, as well as Jay and so on. And for those of you that are here for the first time looking at the Super Patch, we're really, really excited that you joined us to have a look and to listen to some of the professionals that are involved in our company that are linked arms with us. And these are certainly amazing people that have experienced the product themselves and have brought some healing, some longevity, some balance, some stress relief, whatever, into their life. And we're grateful for them to have linked arms with us, and we hope that you will as well. And so, Dr. Anna, always, you're just the bomb. You're just the bomb. And your shirt is awesome. I love your shirt.
I worked hard. Okay. I worked hard daily, daily.
Me too. Yeah, it was great. So, Ricky, take us home.
Oh, thank you guys. We're so appreciative. We're so appreciative of everybody who shared tonight. As always, we love you, Dr. Toker. You're incredible. I'm here to make it weird, like always, because we are truly all obsessed with you. So thank you for everything that you do. Thanks, Terry, for hosting with me and all of the other hosts. You guys will have our recording up for you soon, and have a wonderful rest of your
And
evening.